Welcome to Stress-Free Retirement, provided by the Oklahoma Financial Group, your source for solutions to live a stress-free retirement. You are listening to KZLS, The Eagle. And of course, we've got Doug Rodwell with us this week. Hey, Doug.
Good morning, Michael.
Good morning.
Good Lord woke us up again.
Yeah, of course.
Beautiful day.
We've got a special guest with us today by the name of Dustin Smith. Dustin, why don't you say hi?
Hello.
Dustin, well, first of all, we ought to say today we're talking about Medicare. It's a big time of year for that, and Dustin has got several years in the Medicare market. He's definitely an expert in that area, but he's been in the insurance and financial services business for about 14 years. Is that right, Dustin?
Yes, sir.
And Dustin, of course, holds all of his financial service licenses. He does everything from the brokerage accounts all the way down to the simple life insurance. But today we're going to be discussing Medicare.
And Dustin has a world of experience in that area, and we're thrilled to have you here, and I know you're going to share a lot of good information with the listeners.
Yes, thank you for having me.
But last week we talked a little bit about long-term care, and we had Kevin Turner on, and I know Doug and Kevin had worked for several years together. Dustin and I actually work together in the Medicare market. We do a lot of those Medicare seminars we talked about. I know several weeks ago we talked about Medicare on that show, but as the annual election period, which we'll talk about here in a little while, comes closer and closer, you're going to start seeing all kinds of advertisements and radio advertisements, all those kind of things. And so we thought it'd be important to talk about Medicare. And Dustin, let's start it off with talking about who can get Medicare. Who are the people out there that are eligible for Medicare?
Sure. Ultimately, when people first start approaching turning 65 is when they really need to start looking at Medicare and their choices for Medicare. Now, there are other ways of becoming Medicare eligible other than just turning 65.
And at that point, you automatically become the most important person in the world.
Yes, you become very, very popular.
You get so much stuff in the mail.
Who would have thought, 18, 21, and then 65 becoming such an important birth date in people's lives. But other than turning 65, there are other ways of becoming Medicare eligible. People who have been on Social Security disability for a consecutive 24 months are automatically enrolled into both Part A and Part B of Medicare, which I think we're going to talk about in a little bit.
Yep.
And then for folks that have, unfortunately, that have what is known as end-stage renal disease, which is stage 4 renal disease, those those individuals are also automatically enrolled into Medicare as soon as that diagnosis is met or set.
I think there's a couple other ways you can get it, but for the most part, the vast majority of people are going to be eligible for Medicare once they turn 65.
Yes.
They get popular, they start getting the phone calls. If they're not on the do not call list, they start getting stacks and stacks and stacks of mail.
And what we hear from people we work with is that they're really not looking for more information because they're getting it in the mail every day. What they're looking for is clarification of the information that they already have.
Absolutely.
So that's what I hope we're going to provide today.
Yeah, absolutely, Doug. Ultimately, we've had clients, and I'm sure a lot of folks listening would agree to this or attest to it, that are bringing us stacks of, stacks and stacks of information, and it really doesn't do a whole heck of a lot of good to have more information. What they really need is that clarification.
Yeah, and excuse me, in that stack of mail is all kinds of information. What is Medicare? How does it work? And that's a lot about what we want to talk about today. Medicare has several different parts. And Dustin, if you'd introduce what is Medicare, let's talk about those 4 parts of Medicare.
Sure. So Medicare is a federally organized, federally ran, federally funded program, and you'll hear reference to 4 parts of Medicare. There's Part A, B, C, and D. Part A and B are also referred to as original Medicare because they came out in 1965 simultaneously. Part A covers your hospital care in terms of both hospital, skilled nursing facility, hospice, those types of things. Basically, when you're admitted into the hospital, that's where Part A coverage kicks in. Part B is called medical coverage, but we refer to it more in terms of that's what covers your doctor visits, both your general practitioner, your family practitioner visits, as well as specialty or specialist visits. In addition, any type of outpatient procedure that you may have is generally covered under Part B.
Now, does everyone have to pay into this system? They do, right?
That's a good question. Ultimately, once you become Medicare eligible, you have been paying into the Medicare taxation system through your payroll, in most cases, your payroll taxes, through your working years. As long as you've been doing that, you're automatically entitled to Part A once you turn 65.
So you've been paying for it your whole life, so they give it to you for free.
Absolutely. Yeah,
Hey, that's my joke.
You've been paying for it your whole life, and congratulations, now it's free of charge.
Yeah. So,
But that's only Part A.
That is only Part A. Yeah. Part B, and that's something that it can be challenging to understand. Part B has a monthly premium associated with it. So you are automatically entitled to Part A upon turning 65. And in most cases, you're going to be paying a Part B premium to enroll into Part B. In 2014, that premium for most individuals is $104.90. It can increase from there for high income earners, but essentially most people we deal with and work with are paying that at that level.
So, how much does Medicare? If someone is enrolled in Medicare and they, go to the hospital or go to their doctor, how much gets paid by the system?
The system is designed to have what's known as a coinsurance, and Medicare pays 80% of a coinsurance for covered services. So the other 20%, then it becomes the individual's responsibility. Now, there are many options that somebody can look at in terms of how to account for and pay for that other 20% coinsurance. It is important to note, though, those coinsurances of 80% covered care by Medicare is after deductibles. There is a Part A deductible in 2014 of $1,216 and a Part B deductible of $147 that have to be met prior to that 80% coinsurance kicking into gear.
So we discussed Part A and Part B of Medicare, also known as Original Medicare. We understand that those two together are the bulk of our Medicare coverage. It's going to cover basically 80%. Now, we mentioned there's 4 parts of Medicare. We talked about Part A and Part B. What are those last 2 parts of Medicare?
The last 2 parts, Part C, is where you find what are called Medicare Advantage plans. And Medicare Advantage plans are issued by private insurance companies who are directly contracted with Medicare to essentially, for the time that you're enrolled into a Medicare Advantage plan, take the responsibility of your care from Medicare. And so, again, that is a federally contracted system with private insurance companies. And essentially, most of the time, they're on an HMO basis, a health maintenance organization basis. We'll talk about that in a little bit later detail. Part D came out most recently, and that is where your prescription drug coverage is found. Now, both Part C and D are considered optional. It's not something you have to take or have to enroll into to maintain your eligibility for Part A and Part B, but they are additional options of coverage that are available to you that you can enroll into.
Okay. So we've talked about the 4 parts of Medicare. Now, when we come back, we're going to talk a little bit more about how do we take care of that other 20%. We've already mentioned Medicare Advantage plans.
Because that could be a big number.
Yeah. Oh, absolutely. And we talk about deductibles and coinsurance and things like that. But one of the things that's key to understand with Medicare, Original Medicare, is there's no stop loss on these. So it's 20% of an indefinite number. Now, not trying to scare you, that doesn't have to be a big number. And with doctor's visits and things like that, it's not usually a big a big cost. But when you start talking about hospitalizations and surgeries and cancer treatments and things like that, it can be huge. So anyway, just to summarize what we've talked about so far, we've talked about Medicare, who's eligible. Typically, you age into it when you turn 65. You're going to get Medicare Part A. It's going to cover your hospital. Medicare Part B is really everything outside the hospital, your doctor's visits, things like that. Mm-hmm. Now, Medicare is going to cover 80%, and we're going to go ahead and take a break. And when we come back, we're going to talk more about how to cover that other 20%. But before we do, let me give you our contact information. Our phone number is 310-0098, and of course, you can reach us on our website at okfingroup.com. Again, that number is 310-0098.
Michael, would you mind getting me a cup of coffee during the break?
Sure.
Just black, no creamy.
You must be tired again. All right, we'll be right back after these messages. Welcome back to Stress-Free Retirement, provided by the Oklahoma Financial Group. You are listening to KZLS, The Eagle. Today we are talking about Medicare and Medicare planning. More importantly, this season we're about to be going through where Medicare is going to be on top of everybody's minds. We've got Doug Rodwell, of course, with us every week, and Dustin Smith, our special guest. Right before the break, we introduced Medicare, what it is, really how it works. But one of the things we didn't discuss is how do we take care of the parts that Medicare doesn't take care of? And there's really kind of two parts to that. There's the leftovers after Medicare's done paying, and then there's the completely different services that Medicare doesn't cover at all. And we'll touch on that a little bit too. So, Justin, if you mentioned Part C of Medicare, which is Medicare Advantage plans. Mm-hmm. Let's touch a little bit more on that. But also, what other options do people have?
Well, sure. Before the break, we were talking about Medicare Advantage plans being contracted directly, private insurance carriers contracting directly with Medicare to offer their healthcare plans to Medicare eligible people. When you enroll into a Medicare Advantage plan, for the time that you're onto that plan, that private insurance company through that health plan is going to be responsible for coordinating all of your care for that plan year.
So you buy these Medicare Advantage plans from insurance companies that we see on TV and things,
yes.
Names we're used to hearing like United Healthcare and Blue Cross and Humana, all those. Yeah. You buy them from insurance companies, correct?
Absolutely,
okay.
Yes. To answer your question a little bit more fully, there are other options, particularly for folks that are nearing retirement, but might not necessarily be at that point. They may still be working. One question that we get often is, if I have employer coverage, if I'm on my employer group plan currently, do I need to do anything other than enroll into Part A and Part B of Medicare? And unfortunately, that answer is very specific to the type of employer group plan that you may have access to. Those are not standardized in any way in terms of how they coordinate coverage with Medicare. So ultimately, if you're having that question, the first step is to talk with your benefits provider or coordinator or your HR person there at where you work to determine, one, if you need to enroll into both Part A and Part B, and two, what coverage becomes primary and secondary, meaning does on your particular employer group plan, is that still going to be your primary source of coverage for your health insurance and Medicare be secondary? Or is it going to be the other way around? Is Medicare going to be considered primary and your employer group coverage secondary? And the reason that is important is because it comes down to what your actual cost share amounts could be. And those would vary depending on who's primary and who's secondary. The other side of that, though, is if you're at a place where you can leave your employer group coverage, or it's not available to you once you become retired, then you might want to look at additional options other than just Medicare Advantage or Original Medicare, and that's when we get into looking at what's known as Medicare supplement plans. Those also have a different name called Medigap coverage or Medigap plans.
And that's the more traditional route. That's historically where people have really gone, is the Medicare supplement route. Would you agree with that?
Interestingly enough, Medicare supplements started evolving prior to Part C of Medicare Advantage plans. And it was unfortunately the Wild West. There were all these different plans. Some covered certain things, but not others. They were very difficult and challenging to understand in terms of their coverage amounts. And so the NAIC, the National Association of Insurance Commissioners, created what's known as model legislation, which standardizes all Medicare supplement plans. And so now you have 10 different plans available. They're listed by letters. So there's Plan A through Plan N. I know that N is not the 10th letter of the alphabet. There were some that were kind of dropped along the way, and you're no longer able to enroll in those. But those plans also have those letters behind their name. So you have parts of Medicare with a letter behind it, and you have plans of Medicare supplement coverage with a letter behind it. That's something that makes things even more confusing for folks.
The takeaway I'm getting right now, just sitting here listening to you, is somebody better see an advisor who knows what the heck they're talking about, because this is really some confusing stuff.
Yeah,
I mean, you've been doing this a long time, and you know all the answers, but to people who aren't, all they get is a packet in the mail or, 10 or 12 packets in the mail.
Sure.
This is hard stuff to understand. It's a big decision.
It is, and it's very challenging to understand. It's very complicated. It doesn't have to be. We recommend that you do consult with your financial advisor or find an independent financial advisor, because they can offer you more objective advice in terms of looking at different plans, not only looking at or representing one plan in particular, so that they can look for the choice that's going to be the most suitable for you.
Can I point out that a Medicare supplement plan, whether it be let's just pick one, a Plan F, that's a pretty common plan.
Mm-hmm.
But a Plan F from Blue Cross Blue Shield is exactly the same as a Plan F from United Healthcare or Humana. There's no difference.
Yeah, you're absolutely right, Doug. Ultimately, you have federally standardized plans. So the coverages of a Plan F in particular, which happens to be the most comprehensive of the Medicare supplements, that's not to say it's the best, it's just the most comprehensive in terms of the care that it provides or the coverage it provides. Regardless if it's ABC Insurance Company or XYZ Insurance Company or KJL or whomever, it is going to cover, Plan F is going to cover the same things regardless of the insurance company that it is being provided from. What we have to take a look at then, well, how do you differentiate? There's over 30 different Medicare supplement companies, insurance companies, just in Oklahoma County offering their plans. How do you differentiate between 32 of them? Who's going to be the best for me?
I can tell you how they differentiate them. They call someone like me or you.
There you go.
And the best way to get in touch with us, of course, is at 405-310-0098. It is Saturday morning. There's really good odds we're not at the office. We're probably not going to pick up. But leave us a message. We will call you back. And if it's just a question you want an answer to, of course, we'll do that for you. Dustin, on this Medicare stuff, are you allowed to charge, or can advisors charge for services to give them information about Medicare?
No, you shouldn't have to pay any type of fee or charge for the services that a financial advisor has for you or can offer you in terms of learning, becoming more educated, becoming more knowledgeable about how Medicare works. If you were to enroll into a Medicare Advantage plan or select a Medicare supplement, those insurance companies are going to compensate your financial advisor through, quite frankly, commissions for that enrollment. That's very important to understand, is that if someone is discussing a Medicare supplement plan or a Medicare Advantage plan with you, they may be compensated for enrolling with you or enrolling you into that plan, but you are not compensating them directly. They are being compensated from the insurance company.
Yeah, one of the things I'd like to add to that is, of course, we're advisors and we want to do this. We don't do it. We don't do it specifically for the money. It's part of the service we provide on the full financial plan that we do. Last week we talked about how your Medicare and your Social Security and your long-term care and your life insurance, they really all relate to each other. So this is one of the major services we provide in our whole financial planning. The commissions that agents receive for these services are standardized by Medicare. Mm-hmm. So there's two parts to that. An agent won't be recommending one or the other because they're going to make a whole lot more money if they sell you one versus the other. The other part to that is you're going to pay the same rates regardless of who you buy it from. Whether you buy it from an independent agent or whether you buy it from the insurance company directly, you're going to pay the same rate. So the difference is, who do you want to work with? Do you want to call the insurance company where you have to dial an 800 number and press 1 to talk to a certain department and wait on hold, or an independent agent where you pay the same prices, but you get that personal service where you have a cell phone that you call, something like that anytime that there's any issues. So we've got a lot more show to talk about. We've got a lot more topics to talk about. One of the things we're going to discuss when we get back is really separating that difference between a medical benefit versus a prescription benefit. So we've been talking medical this whole time. We're going to introduce the idea of how do we pay for our prescriptions. Of course, I want to give you our phone number before we leave. It's 405-310-0098. You can reach us at okfingroup.com. Send us an email, leave us a voicemail, whatever you'd like. When we get back, we'll talk about prescription coverage. You are listening to KZLS, The Eagle, and Stress-Free Retirement. Welcome back to Stress-Free Retirement, provided by the Oklahoma Financial Group. We are talking today about Medicare and Medicare planning. We talked a little bit about who gets Medicare, how does Medicare work, even a little bit about how to pay for the leftovers that Medicare doesn't cover. One thing we want to focus on this in this time period we've got is separating the idea that there is coverage for our medical benefits, and then there's coverage for prescription. And we really have to separate those two, because Medicare supplement plans do not cover prescriptions. I want to say that again. Medicare supplement plans do not cover prescriptions. So if you go the route of having original Medicare that's going to cover 80% of your bills, and you buy the supplement that can cover up to the 20% that's left over, you need to buy a separate drug plan that's going to take care of your prescriptions. So that's one of the key things I wanted to focus on there. Now, there are several different things to understand when it comes to Medicare prescriptions, but one of the things I want to start off with is that these plans are specific to certain areas, county specific, even state specific. So I know we push independent agents, but it's important to have an independent agent that is local, that understands the plans that's specific to the area you're in. Dustin and I run across it pretty often, where we'll come across someone who's visiting with an agent that came up from Texas or came down from Kansas. There's nothing wrong with those guys. I'm sure they're great guys, but they don't live around these plans year round to understand the ins and outs of our plans that are specific to our area. So it's important.
And let me mention one other thing. And I've been to several of y'all's workshops. Y'all do a great job. And one thing you mentioned is that whoever you work with, make sure that they are appointed or can represent at least 7 different carriers, 7 different plans, so that they can be totally objective and give you some options, and you pick the best plan that's, meets your needs.
And one of the things we say is there's really nothing magic about the number 7. The point is you want to talk to someone who can offer you the plans that are more important to you, that are more suited for your needs, not the plan that they have to sell. Nothing against those guys that only offer one plan. I'm sure they do a great job. The point is it's about you, not about the plan that they have to offer. Pick the plan that's best for you. Talk to an independent agent. Dustin, let's jump into these prescription drug plans. So medical's taken care of through supplements or advantage plans. How do we get our prescriptions taken care of?
Sure. And again, to remind everyone, that's where Part D of Medicare came about, is that is where your prescription drug coverage is.
And that's easy to remember.
That's the one
for
thing
drug.
that's easy. Yeah, D for drug. That's the one thing that might be easy to remember about the 4 parts of Medicare. You're absolutely right, Michael. Medicare supplements do not cover prescription drug plans, and we do need to keep our medical coverage in one part of our mind, and then the prescription drug coverage as well, and not necessarily lump those two together. Prescription drug coverages through Part D all have the same basis from a federal standpoint. We liken it to, they all have the same structure, the same skeleton that they have to create their plans around, the insurance companies that are in that particular market. Now, they can offer a wide range of flexibility in terms of which drugs are covered, additional services or additional benefits in their plans, but they do have that baseline that is federally regulated. And with that, you have essentially 4 stages of coverage through your prescription drug plan. The first is whether or not that has a deductible to it. Many plans do not have a deductible. You do have a monthly premium associated with a prescription drug plan. Some may have a substantial deductible. Some may have no deductible whatsoever. Past that, you have your initial coverage phase, which is where you get most of your drug coverages. And in that phase is where you're going to be filling your prescriptions and paying some sort of copay at the pharmacy to get your prescriptions filled. Or if you're using a mail order service for your prescriptions, you would have that payment option set up as well. From there, though, you have what is known as the gap coverage, or the coverage gap, I should say.
The donut hole?
Yes.
Some people call it the donut hole.
Yeah. And that's not something that I could eat with the coffee.
No, it's not with the coffee that Michael brought you. Right. Unfortunately, politicians on both sides of the aisle will refer to the coverage gap as the donut hole. And ultimately, if you have lived and breathed and walked through the donut hole, you understand exactly how it works. If you do not, hopefully you never will. And It's very complex and complicated to understand, but if you've never walked through it, you probably won't fully ever appreciate it. If you've walked through it, you know exactly what we're discussing here.
And typically, this coverage gap, the donut hole, is applicable to someone who either takes a lot of medications or maybe only one or two really expensive medications. Mm-hmm. There are dollar amounts that trigger when you get into that donut hole. When your money you spent, the money that the insurance company has spent, gets to a certain dollar amount, and it's a reasonably high number, but not unattainable for sure. A lot of people hit this coverage gap, and it'll transition them. I probably shouldn't use the word graduate, but I sometimes use the word. They'll graduate from their copay status to the donut hole, where they're responsible for the majority of the cost of their medications. Now, there is hope for those people that have really expensive medications. They can get to that fourth stage, which is a catastrophic.
Yes, the fourth and final stage of a drug plan is called catastrophic coverage. And in that place, at that point in time, which is the other side of, that's why I think politicians call it the donut hole, is that the gap is actually surrounded by on the left side, if you're thinking about it in your mind, the initial coverage, and on the right side, that catastrophic coverage. So you actually come through the gap or the donut hole, and at that point, generally speaking, you're only responsible for around 5% of the actual cost of your drug. Unfortunately, the way the system is set up, very few people that go into the coverage gap actually make it out to the catastrophic coverage side.
Well, one of the things that's important is the donut hole, although being kind of set by Medicare, is different for everybody. The prescriptions you take determine when or how you're going to get there. So there's a couple things you can do. First of all, calling someone like Dustin and myself, it makes sense. Call in, come see us. We can run your prescriptions and give you some advice there. You can also go to Medicare.gov. In recent history, our government has not done a great job at building websites, but Medicare.gov is actually a pretty good website. It's a good place to go get information. You can compare drug plans, things like that. But if you want that personal service, come talk to Dustin or myself. You can reach us at 405-310-0098. Now, we've talked a little bit about prescription plans and how they work in general, but there's more than one way to get a prescription plan. You can get them by themselves, or you can get them embedded into a Medicare Advantage plan. Will you talk about that a little bit, Dustin?
Yeah, absolutely. With Medicare Advantage plans, and I'll be a little specific here, in Oklahoma County, there are currently for 2014, there are 19 different Medicare Advantage plans that are available that you could potentially enroll in. 15 of them have prescription drug coverage included. So if you were going to enroll into a Medicare Advantage plan that did have prescription drug coverage included, it would not be necessary to find an additional prescription drug plan. Word of caution, there are plans out there, Medicare Advantage plans, that do not offer prescription drug coverage. And if you were to enroll in them, you would not be able to get prescription drug coverage outside of that Medicare Advantage plan. So that's something to just, again, talk to your advisor about if you have questions about which ones are going to be the most appropriate for you.
So we can get these prescription plans standalone. That's what we'll call them, standalone prescription drug plans that work with your Medicare supplement. The other option is typically if you go with the Medicare Advantage route, most often the drug coverage is included, which is another benefit of a Medicare Advantage plan, is that you really kind of get one package deal. It's all together into one plan, one card, easy to use. Now, one of the things we haven't talked about on Medicare Advantage plans a whole lot is some of the restrictions, the networks that you have to abide by, that those apply to doctors and hospitals as well as pharmacies.
And the county restrictions,
yeah,
too.
And
they're
the
not
county restrictions
offered everywhere.
So they fit a specific need, and to determine if it fits your need, you need to talk to an advisor that knows what they're talking about. And again, that's where we fit in. You can reach us at 405-310-0098. You can come in and have a complimentary visit with Dustin and myself, talk about your needs. Here in just a second, we're going to take a break. We're going to be right back, and we're going to talk more about the annual election period. That's the hot topic right now. That's what everyone's talking about. That's what you're getting bombarded on TV about and radio stations just like ourselves. It's a time to make a lot of decisions regarding your Medicare. Again, our phone number is 405-310-0098. We'll be right back. You are listening to Stress-Free Retirement, provided by the Oklahoma Financial Group and KZLS. Welcome back to Stress-Free Retirement, provided by the Oklahoma Financial Group, your source for solutions to live a stress-free retirement. Today we're talking about Medicare planning, just one piece of the whole pie. It's an important topic. It's not necessarily the most fun topic, but it's an important topic right now.
It is absolutely necessary. There's so many pieces to this puzzle that you've got to get a hold of somebody, an advisor who knows what they're talking about. You really do.
Yeah, I know we like to share stories on our show. Met with a guy not too long ago that thought he missed the boat. He 65, didn't talk to anybody, got his original Medicare Part A and Part B, and nothing else. And then as time went on, he thought, well, I already missed the boat. I can't get anything else. Well, he's come down with some serious health issues, and we were able to talk the other day, and he found out he could still get a supplement plan. And simply by enrolling in that Medicare supplement plan, he has saved himself thousands of dollars a year. And it's kind of an extreme scenario, but it's important to know you don't need to know all this stuff. You don't need to worry about learning all this stuff. That's what we're here for. That's what advisors are for. You can reach us at 405-310-0098. You can go on our website and find all of our contact information there. Our website is okfingroup.com. That's okfingroup.com. Our email addresses are on there. Shoot us an email, ask us questions. We'll be sure to get with you or address them here on the radio show if that's what
Michael,
you want.
you just spurred a question.
Okay.
The gentleman you were just talking about, he had Part A and B.
Mm-hmm.
Suppose someone does not enroll in Part B at age 65, and then they get to age 67 and say, "Hey, I want to enroll in it now." What happens? Is there a penalty?
There's a really common question because that penalty that you're alluding to is thrown around a lot. It's something you need to understand. If you just do not make a decision, you don't get Part B, you just take Part A happens automatically. Part B, you choose not to enroll in, and 5 years down the road, at age 70, you decide that you'd like Medicare Part B. Well, there's a 10% penalty for every year that you were eligible but didn't take Medicare Part B. What they don't want you doing is not paying into the system all these years and then wait until you get unhealthy and then all of a sudden you want to participate. So they encourage you by use of penalty to get you to take it at 65. Now, there's one exception to this is if you're still working and you have employer coverage through a group plan, you can delay your Medicare Part B and avoid the penalty. So if you're still working and you don't want Part B because you're still working and you have insurance at work, if your employer allows it, you can choose not to take Part B and you're not subject to these penalties. You're protected, but it's only with group plans.
What about the prescription drug plans? Does that work the same way?
Yeah, it works very much the same way. The penalty's not as steep. It's not as serious, but there is a penalty for every, they calculate based on month rather than year. There's a monthly penalty for every month you were eligible but didn't have it if you choose to take it later on. Now, right now is there's a lot of buzz about Medicare. I'm sure you've seen a lot on the TV, radio commercials. You're probably even seeing signs and on billboards about it. There's a time period coming up. We're right on it, and right in it is the annual election period.
And
now,
what are the dates?
The annual election period runs from October 15th through December 7th of every year. Now, what's the point of annual election period? Some people call it the open enrollment period, but the government likes to call it AEP, the annual election period. In the AEP, annual election period, runs from October 15th through December 7th, and it pertains to people who either have a Medicare Advantage plan or a prescription drug plan. So if you've been listening to the show and been paying attention to what we've been talking about, the two routes that most people take are either to take original Medicare and buy a supplement, and remember, supplements don't cover drug plans, so you have to buy a separate drug plan, or a Medicare Advantage plan, which typically includes drug plans. So almost every Medicare beneficiary out there has got one or the other. You've got a Part D plan or Medicare Advantage plan. So the annual election period between October 15th and December 7th affects almost everybody on Medicare. So this is the time period to make decisions. It's
one thing I want to point out, too, you did mention that we're getting bombarded with a lot of advertisements on TV. Call this 1-800 number directly to the insurance company, and that's fine. You can do that. But what I want to point out is, to anyone who's listening to us right now, is don't avoid talking to your advisor because you think it's going to cost you more or the premium is going to be more if you do it that way rather than going the 1-800 way. it's exactly the same. The premium is exactly the same, whether you use the 1-800 number or work with an advisor.
Yeah, and the benefit of working with the advisor is you get independent advice and you get personal service. You get to call someone's cell phone if you've got any kind of issues. Now,
and you get to work with great guys like us,
just like us. Yeah. Now there are several things that change from year to year. Medicare Advantage plans and Medicare prescription drug plans, they change every year. There are plan changes. So even if you're not going to change, you need to talk to your advisor and find out what are the changes going to be, and that may spur whether or not you need to make a change. And so this market we're in here in Oklahoma City area, the counties directly related to Oklahoma City, and even up in Tulsa, we know there's going to be several changes this year, and it is going to be very important that you talk to somebody. Now, there are a couple ways you can do that. You can come to one of our Medicare workshops that we're going to be doing. These workshops are going to be all over the city, all over the metro, even out in the surrounding counties. And these workshops, I call them workshops. They're more these sales presentations that are going to be product specific. And you can go to our website at okfingroup.com, click on the events tab. We'll have a list of all the different workshops we're going to be and what products we plan on talking about. Come to one of those, or very simply, you can have a one-on-one meeting. And a lot of times, I know you, Doug, you probably prefer to talk one-on-one with somebody.
There's nothing better than working one-on-one, face-to-face with somebody. We're at 50 Penn Place. Everyone knows we're 50 Penn Place. If you're in the Oklahoma City metro area, you know where that is, on the 13th floor. So, you can go to 50 Penn, go shopping, and then come over and see us.
That coffee you like so much, we've got plenty of free coffee up there. They can come drink as much as they'd like. Now, okay, we've talked about Medicare, how it works, how important it is that this time of year, from October 15th through December 7th, you review what you have. Now, one of the things that the annual election period does not apply to is Medicare supplement plans. There's a very large misconception out there that you can only change Medicare supplement plans during AEP, and that's just simply not true. You can change those year-round. But because it's all kind of a package deal, we're talking Medicare, supplements, and drug plans, it's a good time to do that as well. So if you've got a supplement plan and a drug plan, come in and talk to us, and we will review not only your supplement and your drug, but we'll also do your drug plan at the same time. Now, sorry, Doc, I thought you had something you were going to say. Your man looks like you got questions. Are you confused about this Medicare stuff?
Yeah, it's giving me a headache. No, it makes my head spin.
It gives a lot of people a headache. I mean, you're not alone.
That's why you're more the expert. You and Dustin handle this for us because it's complicated stuff.
And it doesn't have to be. That's what's sad. One of the things Dustin and I pride ourselves on is making Medicare easy to understand, and we really appreciate Dustin being with us this week. And he's in the office with us every week. We do these workshops together. We do a lot of one-on-one meetings with people. I guess that'd be a 2-on-1 meeting, wouldn't it?
Yeah, and the workshops, the ones that I've attended that y'all do, are at public libraries. Mm-hmm. They're educational only. So at those events, you couldn't buy anything then, even if you wanted to. So there's no sales presentations or anything. Now that's different from during this annual enrollment period, where they're more of an event where you go over the specific products and how they work and what benefits they have.
And the changes from one year to the next, those kind of things, absolutely. Now, the next show we're going to have is going to be more on what we call ancillary solutions. It is more about taking care of what Medicare and the other Medicare products don't take care of. Things like dental, vision, hearing, cancer policies, hospital indemnity policies. Basically, if you have to go to a hospital, it'll pay you a cash benefit for every day that you were in the hospital. There are several different gaps, especially if you go the Medicare Advantage route, where we can plug in these ancillary type products to pick up the bigger cost shares that we have. So,
because it really is all a package.
Yeah.
You got to make sure it all integrates and coordinates together.
So next week we're going to talk a lot more about these ancillary solutions. Key takeaways: annual election period is here, and it's an important time to review your Medicare. Please call us at 405-310-0098. Go to our website and leave us an email. We will talk to you next week. We appreciate you being with us. Thank you, Doug. And
mind warming up my coffee?
yeah. All right. We'll see you next week on Oklahoma Financial Group here on KZLS.
The opinions voiced in this program are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, and financial advisor or tax advisor prior to investing. On behalf of Doug Rodwell, advisory services are offered through Investment Advisors, a division of Pro Equities, Inc., a registered investment advisor. Securities offered through Pro Equities, Inc., a registered broker-dealer and member FINRA and SIPC. On behalf of Michael White, investment advisory services are offered through Red Hawk Wealth Advisors, Inc., an SEC-registered investment advisor. Both are Futurities First Insurance Group agents. Futurity First is independent of Pro Equities, Inc.,